Support for makers comes from Clive Daniel Home and by Chico's.
I think for me, we have to get compassion back into a disease and a medical world that's become so driven by the dollar that we forget that there's a human being and a human soul and a family that are sitting in those chairs. So for me, that's my legacy. I hope that I leave Southwest Florida a better place for children and for cancer patients and families than it was when I came here. In 1998, when I came to Southwest Florida, it was sad how difficult it was for people to find cancer services. And I think today it is definitely a better place. The health system did not own the core business of cancer. It was private enterprise, so there was very little that I could use to build a platform that would allow me to springboard a complete cancer program. The one area that was available was GYN oncology. We used that as our springboard to have women's cancers become the core around which we built the rest of the program. We know, by looking at our own data, that we have changed the way that women's care is provided in this community. We know that women are living longer with some of these malignancies, and we know that the care is far better than it was when we got together in 1999. I came here to build the cancer program, and 2 years into that job, I was asked by the president, Jim Nathan, if I would go to the foundation, and they were kind of in disarray, and he wanted me to provide some temporary leadership while they recruited a full-time chief officer. And 12 years later, I'm still there doing that job plus the cancer job. Children would have had to go to either Tampa or Miami to receive care. And Lee Memorial Health System stepped forward at that time and said, we can't let that happen. Kids are our legacy, and we have to make sure that they have services available. And they created a philanthropic fund that would pay the salaries of physicians as they began to build integrated services around the health system. The need for more services created a demand, and now they're out of space. And so the health system a couple of years ago made the decision that if we were going to continue to be able to provide services locally at home and of high quality, that we needed to start building a new children's hospital that would put all of those services together. The Children's Hospital is really a community labor of love, and we're taking it from 98 licensed beds today to 128 licensed beds when it opens. I think that in Southwest Florida, healthcare is in need of some change, there's no question. I think we have a lot of folks that are unable to get care, and the services that we're providing are not driven enough to prevention and early detection, early intervention. We are waiting for people to get sick, and then we complain that they're using our emergency rooms. I think there needs to be a much more creative perspective when we look at how we take care of patients in the future. We have not yet begun to think about how we're going to take care of an aging and elderly population. It's not going to be within the walls of the hospital. So we have a lot of female healthcare workers that are going to need to really redesign in their own mind how they're going to provide care and what their job is going to look like, because in the next 5 years it's not going to look probably like it looks today. My proudest achievement would be the completion of the Cancer Center at Colonial and I-75. That building really creates a center for hope and healing for cancer patients and their families. And by design, it is there as a beacon for people to be able to get treated locally. What I've done to improve the community is to make the community, I think, a kinder place for people struggling with major life-threatening illness. And we have many people in place that are so compassionate, and we have found resources for people that otherwise would not be treated. We make it our daily mantra, I guess. How do we make life easier for a patient or family today? I have a big family. I came from 6 brothers and sisters, and I think part of the beauty of that was that we were all very, very close as a family, still are, but we all were very unique individuals, and my mother treated us that way. And that's what we try to do with my staff, when I try to do it with the community, is to really celebrate each individual's accomplishment and not let that get blended as a group.
Support for makers comes from Bank of America and by Cypress Cove,